And so as I was saying, the original HIPAA legislation did not really have anything to do with privacy and security, but more with healthcare coverage, keeping and retaining that coverage. And within the original HIPAA legislation was a requirement to conduct healthcare transactions electronically. And so pretty much at the 11th hour, the congressman realized, well, if we're going to be mandating that all of this health information from folks is being sent around internal and external networks electronically, there could very well be some privacy and security considerations. So what they did is at the last minute, they tucked in some requirements into the original HIPAA legislation for Congress to come up with privacy and security rules down the road to address that situation. Well, Congress did not act, and so by default, it fell to the Department of Health and Human Services, the federal HHS agency, to come up with privacy and security regulations. First, the privacy rule came into effect in 2003, and that deals with uses and disclosures of PHI. And then a couple years later, in 2005, HHS came out with their security rule. And for the next few years, nothing really changed on the HIPAA landscape until 2009. The HITECH Act was then enacted by Congress as part of the ARA legislation, also known as the stimulus bill. And there were some significant changes to HIPAA in that. And one of the main things that HITECH did was created the CMS EHR incentive program. And of course, tucked away in that program was a requirement for practices, if they wanted to get an incentive program check each year, to conduct an SRA, either conduct one or review a previously conducted SRA. And as I said, HITECH also made changes directly to HIPAA, one of the big ones being that HIPAA, the security rule, applied directly to business associates for the very first time. Then 4 years later, in 2013, the final HITECH omnibus rule came out, which, as I said, they came up basically the final rule on how business associates now needed to comply with HIPAA, in particular the security rule, but also the idea of breach notifications, notifying individuals for breaches of their PHI. This first came out under the HITECH Act, and prior to 2009, there was no concept of a breach of PHI under the original HIPAA legislation. So looking at the HIPAA security rule, basically it ensures the confidentiality, integrity, and availability of all ePHI that is created, received, maintained, or transmitted in computer systems or applications, on portable devices, or in transactions. So breaking that down a little bit, HIPAA security ensures the confidentiality of data. That basically means the privacy. The integrity of the data, and that means that when data leaves point A, that it's the same when it arrives at point B. It's not tampered with at all. And then finally, it ensures the availability of ePHI. This means that when a provider needs healthcare information to perform treatment services on a patient, that information will actually be readily available electronically. And the HIPAA security rule does only apply to electronic PHI, and that electronic data can be at rest on a hard drive or a memory card, or it can be in transit over an open network such as the internet. Looking at the key sections of the HIPAA security rule, we have 3 sections of safeguards: administrative, technical, and physical safeguards. This is really the guts of the security rule, if you will. And for administrative safeguards, what we're really talking about is the requirement to conduct an SRA, providing your staff members with security training, basically on an annual basis, and having contingency plans in place for emergencies, so you can still have access to that ePHI in the event of a disaster or other emergency. For technical safeguards, what we're looking at here is actually controlling access to the ePHI on your electronic system, encrypting your data, which is more or less a requirement of HIPAA, and then using audit controls. It's very important to have those audit controls in place in case you need to do a breach investigation, and you need to do some forensics into whether somebody inappropriately used or disclosed ePHI. Then we have the physical safeguards, and here we're talking about things such as controlling physical access to your facilities, having policies on disposal of EPHI, as well as reusing devices that may contain EPHI. Organizational requirements, there's a couple of important things there. Basically, we're talking about business associates and business associate agreements. The main requirements for business associate agreements are found in the HIPAA privacy rule, but there are also some key requirements for your BAs and BAAs found in the security rule as well. I've mentioned the HITECH Act a couple of times. As I said, this was part of ARA, the American Recovery and Reinvestment Act of 2009, also referred to as the Obama Stimulus Bill. This did, importantly, expand the HIPAA security rule requirements directly to business associates for the very first time. Prior to that, business associates could only be found quote-unquote liable for inappropriate uses or disclosures of PHI via the contract that they signed with the covered entity. But now, under HITECH, for the first time, the business associates are required to comply with all of the requirements of the security rule. Also, under the HITECH Act, HHS was required to perform timely audits of covered entities and business associates for compliance with HIPAA. And prior to the HITECH Act, HIPAA investigations were conducted, but they were rare and they were largely complaint-driven. Now, HHS is required to do them on a periodic basis and then produce reports to the government on the findings. The security risk assessment, as I mentioned, it's a requirement. It's an administrative safeguard requirement of the HIPAA security rule, but it is also required by the Meaningful Use Incentive Program as well as the newer Quality Payment Program. Under a security risk assessment, you are looking to review that you have controls in place to protect the CIA of your EPHI. Again, that's the confidentiality, integrity, and availability of your data. The idea is to review all of the individual requirements of the security rule. Mainly those are found under the administrative, physical, and technical categories that we discussed earlier, and go through those one by one and make sure your practice is in compliance. If you're not, then you use that process to identify potential threats and vulnerabilities which may affect the security of your data. At the end of the SRA process, the idea is to come up with a prioritized listing of your risks, the risks to your data, keeping in mind that the whole SRA process is geared towards protecting your EPHI. As far as how you need to conduct an SRA, what methodology you need to use, the security rule itself, again, which came out in 2005, does not specifically require that you use any particular methodology. Over time, the one particular methodology that we refer to as the NIST SP 800-30 has become the gold standard in the healthcare industry for how you conduct an SRA in the HIPAA style. And it's a relatively straightforward 9-step process. There are other methodologies out here that can be used, but more or less they should all follow this same general pattern. And the 800-30 was put out by the federal government back in 2002 by the NIST, and that's just the National Institute for Standards and Technology, which is a federal agency under the U.S. Commerce Department. So looking at the 9 general steps under the NIST methodology, and again, these should be pretty similar to any SRA methodology that you may wish to use. The first step is to characterize your system. And what we mean here is we try to draw the parameters of the analysis. You can't really begin to assess or analyze something unless you know what the target is. And by your system, we don't just mean your EHR, but that's certainly the main part of your system that's going to be assessed with an SRA. But we're also talking about your workforce members. They can be considered part of your greater system, as well as your data. Your EPHI will be an important part of the system that you'll be assessing through the SRA. Next, we look to see what threats are there to your system. Threats are things in the outside world. They can be natural, human, environmental. Anything in the outside world that can try to harm your data. exploit your system vulnerabilities to end up harming your EPHI. Third, we'd look at those vulnerabilities, and basically these are weaknesses in your system that could be exploited by those outside threats to harm your data. And generally speaking, we do talk about threats and vulnerabilities in pairs because you will need both some sort of outside threat and an internal system weakness or vulnerability before true harm will come to your data. But if you have both of those in place, a threat and a vulnerability, then something bad, such as a breach of your PHI, can happen. After that, we move on to step 4. And here the question is, what controls have you put in place to shore up your system's weaknesses, your system's vulnerabilities? Here we're trying to document any control, which is really anything that can help protect your data. A control can be something as simple as a written policy and procedure that tells your folks what they can and cannot do with the data, all the way up to purchasing technical solutions, such as encryption or antivirus software or firewalls. Those are all sorts of controls that can be put in place to help protect your data. After that, we look to see, in the real world, what's the likelihood that those threats that we identified earlier will successfully be able to exploit your system's vulnerabilities to produce harm to your data. And so if you're using, for example, a web-based tool, a lot of this can be automated behind the scenes. It can run through a number of calculations or permutations and try to determine what the probabilities of those threats exploiting those vulnerabilities could be. And then those are ranked on a spectrum from low to medium to high, depending on how likely they are to occur. Along the same lines with the impact analysis, again in the real world, we try to determine if that bad thing should occur and if some harm should come to your data because a threat exploited a vulnerability, what would actually be the impact on your practice? Would it be potentially catastrophic, or would it be barely even noticeable? And just like the likelihoods, we rank these potential impact analyses on a spectrum from low to medium to high. And then next, step 7, where we determine your risks. This is really the main step of the whole NIST process. This is where we come up with a prioritized listing of your risks. And mathematically, the way we achieve that is to simply multiply those likelihoods that we came up with times the impacts. And when we multiply all those lows and mediums and highs together, we come up with a prioritized listing of your top risks from high to medium to low. And that's really the end result of the SRA process that you're looking for. Next, we have another control step. Earlier, we asked, what controls have you already put in place to shore up your system's weaknesses? Well, now we ask, now that you know what your prioritized risks are, what additional controls could you put in place to help reduce the risks to the data that were identified in that SRA? So 2 of the 9 NIST steps are control steps. So you can see that having those written policies and procedures, those technical solutions in place, encryption, adequate firewalls, updated antivirus software, all of those types of controls are very important in the NIST methodology for conducting an SRA. And then the last step is simply to document the results of the whole process. What this means is the entire SRA, including your action plan, any action plan that's produced as a result of your SRA, and all of your supporting documents, policies, procedures, forms, maybe even screenshots, things that can show your settings and configurations. It's important to keep all of that after the SRA is conducted in case you get a visit from the federal HIPAA auditors down the road. And I mentioned the action plan. Another name for that is an ongoing risk mitigation plan. This is really an important byproduct of the SRA process because once you complete the SRA, which is really a gap analysis, you try to figure out where your holes in compliance are with the HIPAA security rule. Once you find those holes, you're supposed to come up with an action plan so that over time you can come into compliance for those areas where you might not be in compliance at the end of the SRA process. And with an action plan, the general idea is to come up with a listing of your gaps, and then for each gap or risk, attach a specific person's name and a date to those risks. And the person's name, it doesn't necessarily have to be the person who's going to be doing the work and fixing that item, but it should be somebody with general oversight to make sure that that item does get fixed over time. And then over time, once you have that your action plan in place, you will be expected to draft certain policies and procedures that you might not have in place, or update policies if they're found to be lacking. You may be expected to correct certain processes or workflows. If you don't have adequate security training in place for your folks, which could certainly be a finding, that's a common finding of SRAs, you will need to implement workforce member training on the security rules requirements. Again, we've talked about software a couple times. It's also important to update that software, whether it's antivirus or things like that. Ransomware attacks, malware, these things are on the rise. It's very important to keep updated with all of that. And it's important over time to update your plan. You need to document when you've fixed some of the things that were identified as being gaps in that plan, because down the road, if you do get a visit from that federal HIPAA auditor, he or she is going to want to see your SRA, but they're also going to want to see your action plan and see proof that over time you're working on the items that were found to be lacking after the SRA. There have been some audits that have gone on from the federal level, from OCR. Phase 1 of the OCR audit program started in 2011. OCR did not do the audits themselves. They hired one of the big 5 accounting firms, KPMG, to handle those audits. What they did at the time was a set of comprehensive on-site visits by the KPMG folks. And they would have 3, 4, 5 members of KPMG fly out to wherever you were around the country. They would come on site for roughly a week, and they would go through all of your HIPAA documentation to see if you were compliant. It was a very intrusive process. And prior to that phase 1 of the audits being rolled out, OCR did develop what they call the audit protocol tool, and this is still available on their website, hhs.com. Basically, this is a detailed listing of all of the questions that they asked covered entities when they went on site for these comprehensive on-site visits. Most folks would look at it and think that it's a bit of overkill. There's a lot of detail in there. But the whole idea I really approve of. If you can go on there and answer all of those questions in the affirmative, then your chances are you're going to do very well in the event of an actual audit. So a couple of years later, after phase 1 was rolled out, in 2013, OCR released their formal evaluation of what they call the pilot phase of their audit program. And they did find that most entities had areas of noncompliance. In other words, there were very few covered entities that they audited who made it through with flying colors. The most common reason for being out of compliance with something was that the practice was unaware that something was a requirement. I'm just going to Okay, and just as a reminder, if you could each mute your own phone so we don't hear any background noise, that would be appreciated. And then very importantly, in 2013, the OCR's evaluation of their audit program found that most covered entities, most practices, most providers, in other words, had failed to perform a thorough security risk assessment. Even though that's basically the #1 requirement of the HIPAA security rule, most had failed to do that. So fast forward a little bit to July of last year, 2016, OCR finally got around to starting phase 2 of their HIPAA audit program. And this time they handled things a little bit differently. They chose 167 covered entities. This time, however, they did desk audits instead of the comprehensive on-site visits. So basically they sent out questionnaires, they asked for a whole list of documentation, all of your HIPAA policies, procedures, forms, SRA results, action plans, etc. And you had to send those in. And then OCR would review them, and this time they did those themselves. They didn't hire an outside firm to handle that. And sort of where there's smoke, there's fire. If there were things lacking, or if there were areas where they thought there was non-compliance, then they could send a team on site for a more intrusive audit. Another difference this time around with phase 2 was that 33 business associates were selected for audits this time. In Phase 1, there were 0 business associates audited. Also, as with the first phase, for the second phase, OCR did update their audit protocol tool on their website. If you did not get selected for an audit in Phase 2 of the program, chances are pretty good you're out of the woods, although OCR has stated that in 2017 they will still be conducting an additional small number of on-site audits. As far as the audits themselves, if somebody was selected to be audited by OCR, they were not going to get an audit on all parts of the HIPAA rules. If you were selected for an audit for privacy, then you would simply be, you would have a privacy and breach notification rule audit conducted, not security rule. If you were chosen for a security rule audit, then you would not have to worry about showing compliance to the privacy and breach notification rules. So there were 2 sets of audits, privacy and breach and security. As far as how you would prepare your own practice to handle one of these audits, should you get chosen down the road for one, we sort of broke this down into 5 relatively straightforward steps. Of course, the first step is to conduct a thorough risk assessment. Again, this is required by HIPAA in the security rule, as well as the meaningful use and QPP programs. And the whole idea, as we've talked about, is to assess those potential threats to the CIA of your EPHI. You need to go through the security rules requirements, especially those physical, administrative, and technical safeguards, one by one, line by line, and determine which ones you are in compliance with and which ones you are not. The ones that you are not go into your action plan, your ongoing risk mitigation plan. And again, the SRA does represent a snapshot in time. Your action plan is an ongoing process, but the SRA itself only represents your compliance efforts to date with the security rules requirements. So in other words, it should be as honest as possible. Some folks try to sort of shortchange themselves, and some of the questions in the SRA, they're not sure if they could answer it yes or no, so they say yes. We think we can answer this one yes. Well, if you really don't have the documentation in place to support your yes responses, then there's a good chance that if you get a visit from the HIPAA auditor that you're going to get dinged pretty hard on that. So really what we caution is erring on the side of caution. And if you're not sure if you should answer something yes or no, then just answer it no. That item will show up on your action plan, and so you can, over the next weeks and months, you will be able to work on that item as well as the other ones that you are found out of compliance with. And that's the best way to handle it in the event of an audit. Again, we've talked about the methodology that's most commonly used. There are other ones out there, but we recommend using the NIST SP 800-30. It is considered the gold standard for how you conduct security SRA. And the reason for that is because OCR has basically given its approval to it. Not officially, but in several indirect comments, they have said that this is a very, very good way to go if you're going to be doing a HIPAA SRA. Once the SRA has been completed, that's only part 1 of the 2-part process. The second part is coming up with that action plan to address the top risks. If you do get a visit from the federal HIPAA auditors, they are going to want to see not just the results of your SRA. Again, it's a requirement that you conduct the SRA, but they are also going to want to see that you are taking your risk mitigation seriously. This is not a one-and-done type of a deal. This is an ongoing plan, your to-do list, basically, where in the weeks, months, maybe even years to come, after your SRA is completed, you will continue to work on that plan to fix the risks, the problems that were identified in that SRA. It's important to treat this as an ongoing plan that has target dates. The dates do not have to be set in stone, but the dates can be important. At least you have a certain date that you're trying to fix that item by. And again, have names attached as well. People have to take ownership for these particular risks, and we have found that if names are not attached to the risks, then things do not get fixed over time. Very important to keep a log of your process, the progress that you're making on those risks identified through the SRA. If things are getting fixed, who is fixing them? When are they fixing those items? Who is actually doing it? It's also important that as part of your action plan, a lot of your findings are going to be written policies and procedures. A big part of the security rule is having certain written documentation in place. The SRA usually will indicate that you don't have certain policies in place. Well, in the weeks and months to come, if you find time to sit down and work on those policies and whip them into shape, it's important to attach those to your action plan to show a potential auditor, yes, we did have this finding, but we came up with that policy, we implemented it, we train our folks on that policy, and here is the policy that we produced. Part of that plan might be updating your software, buying new software if you don't have antivirus or encryption capabilities, for example. You may be required by your SRA to buy that new software or update your existing procedures. And then also, once you write your policies, once you purchase new software, you will need to train your folks on the new things that you have done in response to your SRA. Very important to have a security training program in place, and a lot of organizations overlook this almost completely. Basically, in a nutshell, you're required to train your new staff on your security policies and procedures, basically within the first couple of weeks of starting. And then on an annual basis thereafter, you should be retraining your folks. Also, the HIPAA security rule requires occasional periodic security reminders. The rule does not really say much about the form these reminders need to take. They can be occasional emails to your staff on security reminders, passwords, encrypting data, things like that. They can be face-to-face in staff meetings. They can be something posted on a bulletin board or over your intranet. Again, the security rule is light on details, but you do need to have a training program and periodic security reminders. After that, we stress that it's very important to document your policies and procedures. Risk analysis and assessment, basically you should have written policies that lay out your SRA process. How often do you conduct an SRA? It should be on an annual basis. Under the Meaningful Use program, you are required to either conduct an SRA during each attestation period or do a review of a previously conducted SRA. Unfortunately, the feds have given very little guidance on what would constitute a thorough and robust enough review for meaningful use purposes. But what we think it means is basically taking the results of your previous SRA, if you've conducted one, and then going through all the findings from the previous year, one by one, line by line. And if you still have outstanding to-do items from last year's results, then create a new action plan for this year. And of course, it's an action plan, so it should have names and dates attached to each ongoing risk, each to-do item. And you should keep track of those things as they are fixed, as they are mitigated, just like you would with a regular SRA. But my point is, it's important to have all of these things not just in place, but laid out in a written policy that you can hand to an auditor to show that you do take the SRA process seriously. Information security policies, these are things, you should have written policies that explain how folks can have access to your system, how they can have access to the EPHI on your system. It's important to have all these rules in place at your practice, but it's also important to have a written policy that explains them. Security incident management, this is very important. This overlaps with breach notification. A security incident can take many, many shapes and forms from A to Z. It can be simple pings against your firewall all the way up to large-scale breaches of patient data. But you should have a written policy that explains what your folks should do should they suspect a security incident. Who does that get reported to? How does that person that receives that report then investigate the incident? If it's something that should rise to the level of a breach of PHI, who takes over from there? Who sends out notifications of breaches? This should all be laid out in a written policy. Business continuity and disaster recovery. This is another area that's grossly overlooked by a lot of, especially smaller and mid-sized practices. You need to have specific plans in place for what you would do at your practice to continue operations in the event of a disaster or other emergency. First and foremost, you need to have a written policy on backing up your data. A lot of times these days, folks use cloud-based EHRs. That's a great idea. Those EHRs back up your data off-site in the cloud. That can be a big help when it comes to your disaster recovery policies. But really, these documents should look at everything from as simple as a short-term power outage and how that would affect things at your practice, all the way up to a worst-case scenario where a tornado comes through and damages your facility and you may have to shut down for an extended period of time, and everything in between. But the point is you need to have these things in written policies, and you need to also test your procedures, your disaster recovery procedures from time to time to make sure that they would actually work in the event of a real emergency. Next, we have data backup, destruction, and encryption. We talked about data backup a little bit. That ties directly into disaster recovery. You need to be able to make sure that you have exact copies, exact backup copies of your ePHI in the event that something happens to the originals. You need to have written policies on destruction of ePHI when it's no longer necessary, or destruction of the equipment that might contain that ePHI. And you also need to have written policies that talk about how and when you're going to encrypt your data, your electronic PHI, whether that data is at rest on a hard drive or whether it's in transit, such as over the internet. You need to have policies that address encryption of data. Internal auditing controls, we did mention this briefly earlier. Very important to have a written policy on this to show that if you need to do a mini investigation, if there's a complaint about inappropriate access to ePHI, inappropriate use or disclosure of PHI, you need to be able to audit your system to be able to go back in time and see who was looking at what data and when. And then finally, physical security. You have to have these policies in place, these written policies that talk about who can get into your facility, what's your process for ID badges, control cards, access cards, how many physical keys are handed out, especially keys to the server rooms or data closets, those areas where you have computer-type equipment that may contain ePHI. All of these are part of your physical security, and they need to be well documented in written policies. Next, once you have all of your policies and procedures whipped into shape, you need to train your staff on those policies and procedures. The privacy and security rules both require training, HIPAA training for new hires. As I mentioned earlier, not everyone needs to have the exact same training. It can be tailored for specific job duties if job roles do differ. But regardless of how it's conducted, it has to be appropriate for each job function, and then you must document that the training occurred. We have found that sometimes folks do training, but they don't take note of who attended and what the training actually entailed. Very important that you keep copies of your training materials for at least 6 years. That's a general rule under HIPAA. Keep all of your HIPAA-related documentation for at least 6 years, and also keep track of who attended. As I mentioned earlier, the annual HIPAA training requirement, new employees should be trained relatively soon after they come on board, but approximately annually thereafter, they should be given a refresher on HIPAA. It should include privacy and security, and then periodic reminders, whether it's in an email, face-to-face, via newsletter, another HIPAA requirement under the security rule. And part of the training, sometimes this is overlooked by folks, you should train folks on the names of their privacy and security officers. If they can't identify who their privacy officer is or their security officer, chances are reduced that they're going to be able to successfully report a potential incident or breach of PHI. So just make that part of your training process to instruct on who those folks are and how they can contact them if they do suspect an incident or a breach. And then the last of the 5 steps is to document, document, document. As I said, it's a HIPAA requirement in general to keep all of your HIPAA-related policies, procedures, other documentation for at least 6 years. Your HIPAA policies should be accessible by the staff who need them when they need them. So putting them on the intranet, the iNet, is a very common way to make those policies readily accessible by staff. And then also as part of documentation, it's very important under the security rule to keep an updated list of your assets that can contain your EPHI. Assets could be laptops, desktops, tablets, smartphones, even medical devices. These days, a lot of medical devices have the ability to store a certain amount of EPHI. Important to keep a listing of all those assets that could contain your EPHI, because in the event of a security audit, that's one of the first things that the auditors will ask for. The audit itself will generally follow the EPHI, and so they're going to want to see not only a listing of your assets containing your EPHI, but also a network diagram. They're going to want to see a map or a listing of your routers, firewalls, switches, those sorts of devices, which generally do not contain storage capabilities for EPHI, but taken together, those types of devices do create the infrastructure for your network, and a lot of your EPHI is going to be flying around the network. So asset list and network diagram, important to have updated versions of those in case of an audit. And then any SRAs that you've conducted over the past 6 years, along with the action plans, you need to keep those results. The HIPAA auditors can go back at least 6 years for requests for those types of documentation. Other associated HIPAA forms and documents, access requests, authorizations, complaints that you might have received on your privacy or security program, you need to keep those around, as well as logs of breaches. If you have had potential breaches of PHI that you've logged, or if you've had actual breaches of PHI, you need to keep logs of those, as well as the results of any incident or breach investigations that were conducted. And I've mentioned this a couple times, but very important that the training has to be documented, whether it's new hire to show that your new hires are actually being trained within a reasonable time frame, and then annually thereafter. You need to prove that you're providing adequate training to your folks on HIPAA, and then you need to prove that they received it by certain dates. And again, this is something they can go back at least 6 years to request, so keep that documentation as well. And with that, again, MetaStar does offer security risk assessment services. We've been doing this for a long time. We have expert knowledge. We actually become part of your team. We use our experience to become kind of an internal auditor, if you will, where we try to help you with your security program into place before the outside auditors, the federal auditors, come in and do the audit for real. So with that, we will open it up to questions. And we did receive a few questions so far. One question had to do with a security risk assessment that was conducted last year, and these folks have been working on their outstanding items, their to-do items from the SRA. They still have some left to go. They haven't remediated everything, and they're wondering at what point do they sort of shut down the process from 2016 and then perform a new SRA for 2017? That's a very good question, a pretty common question. And our answer to that is really the action plan from last year is an ongoing process. It doesn't really end. You do need to do a new SRA or review a previously conducted SRA on an annual basis for meaningful use and for QPP. So at some point you will need to go in and redo the SRA process. And that is going to take into account the fact that you have been working on a lot of your action items from the previous year. So basically your 2017 SRA results are going to look a lot better if you have already fixed, say, 2/3 of the issues that were identified the previous year. Those things that you did not get around to fixing from last year's SRA will simply, in the 2017 SRA, roll into your new action plan. They will be considered outstanding to-do items, and just like they were part of your action plan from last year, they will simply be part of your action plan from this year. And again, you should have quite a few fewer action list items to work on for this year. So maybe it'll be easier for you to get around to fixing those few things that you had left over from the year before. Another question is asking about the format, the methodology for conducting an annual risk assessment. In general, we talk about the NIST methodology for conducting it. There are a lot of web-based options these days for conducting security risk assessments. A lot of really good tools online that are available for varying costs. Some of them are free via OCR, for example. The federal government does put out an SRA tool. What that really is, it's a glorified spreadsheet system. There's not really much built in as far as expertise to help you with the process. It's sort of a regurgitation of the federal requirements, but it is available for you to use as a tool. Most of the web-based tools that you will find are available out there will use the NIST methodology. So that's one thing to look for if you are shopping around for different tools to use. Make sure that they use the NIST SP 800-30 methodology or something very similar to it. And then we do have another question, is there a specific time frame to get new hires trained by? And there really is not. The way that the security rule and the privacy rule, the way that those rules are written, they're written very sparsely. And basically the HIPAA security rule just says you need to have a security awareness and training program for your workforce members, including management. That literally is all it says. So we read into that, over time, we read into that best practices. And the auditors also will look, when they come on site for an audit, they will be incorporating best practices when they do the audit. What that means for training is that within the first 30 days for sure, you need to have staff trained on your HIPAA security. I recommend within a week or two, and if at all possible, prior to that new employee accessing your EPHI. Really, in a perfect world, no employee should ever be able to access EPHI without having been fully trained on the HIPAA security training. So that's my recommendation, within 30 days for sure, and then within a week or two, if at all possible, but prior to EPHI access. And then again, HIPAA does not specifically require you to conduct annual security training, but that has become very solidly a part of best practices for HIPAA compliance these days. So if you get a visit from HIPAA auditors and you're not conducting annual security training, you will certainly get dinged for that in an audit. Then we did have a question on security risk assessment costs. And if you're looking at MetaStar for assistance with an SRA, then the costs can vary quite a bit. If you're a participant in the Medicaid HIT program, then depending on your particular circumstances, there could be some cost support involved there. It would depend, again, on the particulars of your practice. In general, for a full-blown SRA with our assistance, it's going to start at around $2,500. There are some various things that can make the costs go up from there. But again, for some practices, there will be price support available. I would recommend emailing myself, MetaStar offline, and we can have a chat about the specifics of the cost for your particular practice. And then a question that came in, any difference in a large versus a small practice? In theory, the answer is no. The HIPAA security rule is written to be scalable, and what that means is the way that it's written, it's supposed to, the same requirements are supposed to be able to apply to your smallest practice all the way up to a large hospital or medical center. That is in theory, though. In reality, when it comes to complying with the HIPAA security rules parts and pieces, there are some big differences. Larger practices are just, they're going to have a lot more staff, a lot more resources to dedicate to HIPAA compliance. They're going to have just a lot more knowledge in general. It's much more difficult for smaller practices to comply with, for example, encryption and antivirus and firewall and all of these different things. It can be very, very confusing. And so for the most part, smaller practices will need to reach out and get some sort of help. Whoever is providing your IT support, that's the first place I would start. When it comes to a security risk assessment, a lot of the questions that you'll be answering in that process will be fairly technical. I would lean heavily on your IT support staff, whether it's part of your practice or you outsource that to a third party. Get them involved, and they will be able to help with a lot of those more technical questions. Again, if you're a larger hospital or medical center, regional medical center, you're probably going to have that sort of expertise in-house already. Now we do have a question on testing, on HIPAA training testing and whether that needs to be built into the process or not. And again, I read basically verbatim what the HIPAA security rule says about training. It's one sentence that says you have to provide security awareness training to your staff, including management. They do not mention anything in there about a test, but we do at MetaStar, we strongly advise you try to build in some sorts of quizzes, some sort of interactive feature, a way that you can measure whether or not the information you're presenting in your training is actually sinking in, is being absorbed by your workforce members. It's not specifically required by HIPAA, but more and more the auditors are expecting to see that sort of a process incorporated in your training. And I'm guessing down the road, if and when they make additional tweaks to HIPAA, that may be something that they will require. Because the HIPAA security training requirement is so vague, I am expecting that in the future, probably through guidance or additional regulations, they will build in more detail, and they will basically expect some sort of interactive feature, some way for you to measure how much the training is actually sinking in. So that's a very good question regarding testing or quizzing during your HIPAA training process. All right, at this point, the lines are unmuted, so were there any additional questions that anybody wanted to ask at this point? Okay, it sounds like we don't have any other questions. Just as a reminder, please look, we are going to have open office hours, a webinar or email on SRA's June 20th, sort of a follow-up to this presentation. And seeing that there are no other questions, this will conclude today's presentation. Feel free to email me should you have any questions that occur to you later. And just as a reminder, there will be a recording of today's webinar, as well as other recent webinars that may be of interest to you. They will be available on our website at metastar.com. The best way to find those presentations is to simply go to our website and in the search feature, enter webinar, and you'll get a full list of those. Thank you all for joining us today, and have a nice weekend.